Kogi State government has been commended for her support towards primary health care service delivery in the state. The executive director, Kogi State Primary Healthcare Development Agency, Dr. Abubakar Yakubu, gave the commendation on the commemoration of Safe Motherhood Day held in Lokoja, the state capital. Dr. Abubakar explained that the agency has been able to upgrade and revitalize personal health clinics in every political ward of the state, recruiting over 60 midwives to health facilities across the state. Our reporter has more.
According to the World Health Organization (WHO), pregnancy and childbirth-related deaths kills around 830 women per day globally, and to curb the cases of deaths, the Kogi State Primary Health Care Development Agency is leaving no stone unturned towards ensuring that pregnant women deliver their babies without any complications. To set the record straight, the Kogi State Primary Health Care Development Agency, under the Executive Director, Dr. Abubakar Yakubu, for the first time in the history of Kogi State, is observing the National State Motherhood Day 2023 with the theme Access to Quality Maternal Care, a right for every pregnant woman. He noted that pregnancy-related problems and mortality rates among women necessitated the commemoration of the day, urging all stakeholders to key into the vision to reduce pregnancy complications among young women.
They refuse to also attend, go to the hospital for delivery. Some of them, even after delivery in the hospital, they also refuse to go for postnatal care. The importance of this day is to advocate and then inform them to know the importance of attending antenatal clinics. Several, illnesses that is associated with pregnancy will be uncovered during ANC. And if these things are not done, they may stand the risk of having, their babies, losing their babies, maybe intrauterine or maybe immediately perinatal. So this is why we are here encouraging them to go to antenatal, receiving the hematinics, having all the counseling required of them, and then preparing them for the labor. And sincerely, this year team has also addressed the most important and the critical aspect of the safe motherhood, because we are looking at how these mothers will have access to quality information that will enable them to get over all the minor complaints and the major complaints associated with pregnancy.
Dr. Mary Onoja Alexander, while delivering her paper titled Overcoming Delays to Access Maternal Services, tasked governments at all levels to put policies in place to protect mothers. She admonished pregnant women to always make use of recognized health facilities while delivering their babies.
And for us in Kogi State, the government has done a lot. They were able to provide free antenatal services for our mothers through the CHIPS program that is taking place in 4 local governments of the state, Ida, Basa, Yagbo West, and Okene local government, which these CHIP agents will take the messages to mothers in their homes, that way informing them where they can get help and what to do in case they encounter any problem during pregnancy, delivery, and the post-delivery period. Also, the healthcare insurance in the state provides free services to vulnerable groups, and mothers and under 5s are part of the vulnerable group. So with all this, we don't expect to get any maternal death in the state. Most of the things that happen now is ignorance among the women. But with this lecture today, and with them be present, our religious bodies, market women that are here, they will take these messages to the grassroots to educate more mothers on where they can access care for them when they are pregnant, and thereby reducing the maternal mortality in the state and in the country as a whole.
There are different ways to access it, but some people are not aware or they are unable to access these healthcare services. So that is what the lecture was meant for, to tell them that these healthcare services, at primary healthcare level, we give healthcare as far as your doorstep. Even if you don't come, we'll move into your houses. Our CHIPS agents, we have community influencers, they move into the houses to tell them to come out and receive these healthcare services. It has been provided for you, either free or just pay a token at primary healthcare level. So this is all what we are doing. We are telling them about danger signs. They need to identify it so that they come to the hospital for emergency care.
Goodwill messages were delivered by the Secretary to the Kogi State Government, Dr. Folashade Arike Ayoade, Kogi State Head of Service, Hannah Odiyo, Executive Secretary, Kogi State Health Insurance Agency, Dr. Aledare Adekunle, and key players across the Ministry of Health. High point of this year's National Safe Motherhood Day was the distribution towels to more than 100 pregnant women in Kogi State. Jennifer Odimayo, reporting for ML.